Hello and welcome back to the liver class where we discuss all the conditions and diseases affecting the liver. And here we will talk about the alcoholic hepatitis. Alcoholic hepatitis is an acute inflammation of the liver due to alcohol use. And here we will talk about the definition, pathophysiology, signs and symptoms, diagnosis and treatment of this condition. You can always use the chapters in the video description to skip to other parts of this video if you would like to. So alcohol is quite bad for the liver. It causes a range of diseases. They are on stages and we call them alcoholic liver diseases. And alcoholic liver disease starts as alcoholic fatty liver disease. This is an early stage of alcoholic liver disease. There is an accumulation of fatty acids in the liver in heavy drinkers. And then comes the alcoholic hepatitis, which is our topic of this video. So there would be inflammation of the liver after binge drinking of alcohol. And with time, those two conditions, the alcoholic fatty liver disease and the alcoholic hepatitis, would lead to fibrosis of the liver and liver cirrhosis. Because of recurrent injuries to the liver caused by alcohol, end up with fibrosis, which is liver cirrhosis. And in this video, we will discuss the alcoholic hepatitis. So let's start with the definition for alcoholic hepatitis. So it is hepatitis, which is inflammation of the liver. It's a severe disease that occurs after heavy drinking. The patients with alcoholic hepatitis are mostly have a history of at least 10 years of heavy alcohol drinking. And alcoholic hepatitis can range from mild to severe, and mortality in untreated cases is 50% in 30 days. And that shows you how much severe this condition is. And the condition comes suddenly and progresses rapidly. Now let's talk about the pathophysiology of alcoholic hepatitis. So we have two mechanisms for alcoholic hepatitis. The first one is that there is a direct injury to the hepatocytes, and it is by alcohol and it is metabolites like acetaldehyde. So the first mechanism is that the alcohol and it is metabolites like acetaldehyde directly damage the hepatocytes. The second mechanism is that the alcohol damages the enterocytes, which are the cells lining the intestine, and it would disrupt the tight junctions between these cells. So the tight junctions between these cells are disturbed, so there would be a bigger gaps between them, allowing more materials to pass through to the blood. And this increases the intestinal permeability and allows the bacteria and fungi to enter the portal circulation and travel to the liver. Remember that the intestine venous drainage comes to the portal vein, which comes to the liver, and by that the fungi and bacteria would go into the liver, and these two mechanisms acutely lead to alcoholic hepatitis, and with time they lead to liver fibrosis, which is liver cirrhosis. Now let's talk about the signs and symptoms of alcoholic hepatitis. So the patient presents with fever because it's an inflammation, and inflammation is associated with fever usually, and also there is fatigue. The patient feels weakness. And also the patient present with jaundice, which is yellowish discoloration of the skin and mucous membranes. Like in this picture, we can see like the sclera is yellow and the skin is also yellow. And this is because one of the functions of the liver is to metabolize the bilirubin. The bilirubin is a breakdown product of the RBCs. So when the RBCs break down, one of the breakdown products for that is the bilirubin. And bilirubin, as we mentioned, is metabolized by the liver. And once the liver is non-functioning, the bilirubin would accumulate, and this would lead to the bilirubin going to different tissues of the body, one of them is the skin, and leading to yellowish discoloration there. There is also abdominal pain because inflammation is associated with pain, and it is especially the right upper quadrant, which is where the liver is situated in the abdomen, and it is with tenderness. Another symptom of alcoholic hepatitis is ascites formation. So ascites is the fluid accumulation in the abdominal cavity. So the fluid would leak from the circulation and into the abdominal cavity. That is because one of the functions of the liver is to synthesize the albumin. The albumin is related to the oncotic pressure, and the oncotic pressure helps keep the fluid inside the circulation. So generally speaking, regarding the blood movement inside the vessels, we have the hydrostatic pressure, which is the pressure formed by the heart to push the blood into the circulation, and we have the oncotic pressure, which is formed by the proteins, mainly the albumin, which help keep the fluids and the blood inside the circulation. And once the albumin can't be synthesized anymore by the liver, the fluid in the blood would leak into the abdomen, leading to ascites. Alcoholic hepatitis might also lead to hepatic encephalopathy. So hepatic encephalopathy is a brain dysfunction due to liver disease. So one of the functions of the liver is to detoxify the blood from toxins, and once the liver can't do that anymore, the toxins would go into the brain and they lead to inflammation there, and this would lead to brain dysfunction, which termed as hepatic encephalopathy. The patient present with DLAC, which is decreased level of consciousness, and this ranges from the patient being confused, stuporous, to being comatose. There is also astraxis, which is flapping tremor, and there is change in behavior of the patient. Now let's talk about the diagnosis of alcoholic hepatitis. So the patient present with a history of heavy alcohol intake. For men, consuming 5 or more drinks on any day or 15 or more per week is labeled as heavy, and for women, consuming 4 or more on any day or 8 or more drinks per week is also labeled as heavy drinking. Physical examination reveals tachycardia, which is increase the rate of the heart, and tachypnea, which is increase the respiratory rate, fever, hepatomegaly, and right upper quadrant pain and tenderness. And there might be also spider nevi, muscle wasting, and gynecomastia. The liver function test shows that the AST on the ALT ratio is more than 1.5, and the AST in most cases is less than 500 units per liter, and the ALT is normal. The bilirubin is more than 3, and the liver biopsy is not required unless you are not sure, which then you order the liver biopsy to confirm the diagnosis, and you order ultrasound to exclude the differential diagnoses like the acute cholecystitis and other differentials related to the biliary tract. Finally, let's talk about the treatment of alcoholic hepatitis. So the number one thing is that abstaining from alcohol, and glucocorticoids can be used to suppress inflammation for patients with severe disease, and nutrition supplementation with proteins and calories is required because remember, one of the functions of the liver is related to glucose, gluconeogenesis, and glycogenolysis, and also the liver is responsible for producing different types of proteins, and once the liver can't do that, you need to supplement those to the patient. And acetylcysteine might be beneficial, and liver transplantation may be needed if the other lines failed. And with that, we reach the end of this video. Thank you guys for watching. Please make sure to like this video and subscribe. And if you want to support more, you can by subscribing to the Patreon, link provided in the description of this video. Thank you for watching and peace.